Hello, welcome to Training Minutes. Today I want to talk about EpiPens, epinephrine delivering devices that many of us use in the pre-hospital environment to give adrenaline to patients with asthma, with allergic reactions, and other conditions that require that sort of medication. It's time to throw out your old epinephrine EpiPen trainers that look like this and open the box that you've gotten in the last year from the manufacturer and discover the new trainer and the new pens that are being packaged in the container. Most EMS units carry a 2-pack of EpiPen Adult and EpiPen Junior, similar to this, which now contains a clip that holds the two pens together. It also, in the pack, contains a trainer that you can use to get up to speed on the new pens themselves. Unlike the previous product, the new device comes inside of a protective case that can be used as a sharps disposal once the pen is actually used on a patient. So it's no longer necessary to package your EpiPens with a sharps disposal container. Let's look at the trainer. The trainer is very similar to the old pen, and the administration is exactly the same, but you'll notice that instead of a black tip, they've colored the tip orange, which should signify that that's not the side that you want to hold your finger or your thumb on. That's the side that's going to administer the needle to the patient. We'll pull the blue top off to activate the pen, similar to the old epinephrine pen, which had a gray top. And we'll administer the pen in exactly the same fashion as we had previously done, which is to place it on a large muscle, preferably on the thigh. And you can do this right through the clothing. There's no need to pull off a patient's clothing unless it's very thick clothing. And with a downward firm pressure, you're going to administer the epinephrine to the patient. Now notice, I pushed down, I heard a click from the pen, which means that the needle has entered the skin, and I need to hold the pen in place for at least 10 seconds so that the epinephrine dose is delivered into the muscle of the patient. Once you've done that, you pull the pen back, and you'll notice that in the new EpiPen, a needle has been covered by a retracting orange piece of the pen. Now in the trainer device, you can reset that by squeezing the orange piece and resetting it into the pen. In the standard EpiPen, the non-trainer device, you'll find that this cover has now permanently protected the needle, and you're ready to take the pen and place it into the sharps disposal container that it came with. So take a look at your new epinephrine pens and look for the trainer that's inside the packaging. Put it out for your members, use it at a drill, make sure that people are aware of the change in the product. Again, you want to caution your members that we repeatedly across the United States see incidences of people delivering epinephrine pens in the wrong direction and placing their thumb on the part of the pen where the needle comes out, which is not something that you want to do in an emergency situation. Epinephrine in a digit like a thumb or a finger can cause necrosis and can cause damage to the tissue. So if that's an injury that one of your members sustains, you definitely want some medical care to follow up on that. Thanks for watching Training Minutes. I'm Mike McEvoy, the EMS editor for Fire Engineering.